I often get asked the question, am I a good candidate for a penile implant? Or who is a good candidate for a penile implant? Basically, any man that suffers from a persistent erectile dysfunction that no longer responds to oral therapy is a very good candidate for a penile implant. We even have patients that are either tired of taking oral medications or have side effects, serious side effects with oral medication. Those patients are also candidate for erectile dysfunction. Basically, any man who suffers from advanced organic erectile dysfunction is a good candidate for a penile implant. Penile implant surgery has been a procedure that's been around for many, many years, and most insurance companies, including Medicare, cover the procedure. As a matter of fact, penile implant surgery is the only erectile treatment that is covered by Medicare. The penile implant multi-component device was invented in 1973 and has been covered by most commercial insurance, including Medicare and Medicaid, since 1973. There are basically two major categories of penile implants. We have the inflatable devices and non-inflatable or semi-rigid devices. The semi-rigid or malleable devices are a rod which has a memory which is inserted in the shaft of the penis. So the penis is always erect. Inflatable devices come in two flavors. One is what we call a two-piece device that has cylinders and a pump, and the multi-component three-piece device which has cylinders, a reservoir, and a scrotal pump. One of the main advantages of an inflatable implant is that it feels very natural. We have many patients that are married and their wives don't even know that they have an implant. A malleable device is always firm. It's more difficult to conceal, although it's practical for patients with challenged manual dexterities or patients that are very old and have lost strength to inflate the device. It is not the preferred penile implant in the United States. As a matter of fact, less than 10% of implants that are performed in the US are of the malleable type. We tend to use these devices for procedures involving patients who had failed implants in the past and had complications such as infections or have a lot of scar tissue which prevents dilation of the penis to put in an inflatable device. In order for patients to be satisfied, it is extremely important to maximize the size of the penis with a penile implant. That is done through several strategies. The first is to make sure that we prepare patients' expectations. The way we do that is we perform a penile injection test in the office, and we measure and document the measurements obtained in the office. That allows the patient to see exactly what to expect. The flow sheet that is obtained during the office visit will then travel to the operating room with the patient. And after the penile implant is placed inside the patient, it is inflated and the penis remeasured. We want to make sure that the measurements that is obtained in the operating room is the same that is obtained in the office. In that way, we can guarantee the patient the size of the penis after a penile implant. The inflatable devices have a tiny pump, it's the size of a marble, that is placed underneath the skin in the scrotum. So everything is placed through a small 1-inch opening in the sac of the scrotum. The incision or the cut in the scrotum is performed in my practice in a vertical fashion midline, which is concealed in the medium raphe of the scrotum. In that way, nobody knows that the patient has an implant. The pump is placed behind the scrotum and is very discreet, so the patient can find the pump, squeeze it, and by squeezing the pump, fluid is transferred from a reservoir into the shaft of the penis. The erection obtained is extremely rigid, over 10 pounds per square inch of rigidity. That is almost harder than a normal erection. After orgasm and ejaculation, a valve is squeezed, which resides on top of the bulb in the same area as the pump, and that releases the fluid back into the reservoir. In that fashion, the device does not need to be refilled. I've had patients with the same implant for over 20 years. Nothing is removed from the penis or the scrotum to put in a penile implant. Therefore, we have patients that continue to have partial erections even with an implant. If a patient is in the doctor's office and inflating the implant, there's no engorgement of the glands of the penis, and there's no dilation of the penile flesh that surrounds the cylinders of the penis. However, in the comfort of one's home, with arousal and foreplay, there will be engorgement of the glands and the penis will dilate. So it's important for patients to know that they still can have partial erection. Now that varies from patient to patient and also varies according to the degree of erectile dysfunction that the patient suffers prior to the penile implant. Sensation, ejaculation, for most patients are preserved. Of course, if a patient had their prostate removed, the patient will lose the ability to ejaculate and will have a dry orgasm. I love it when patients call me the day after an implant and they tell me, gee, I didn't realize this was going to feel so normal. The penis feels so natural. The implant is completely concealed, and that's really what's great about a penile implant. So a person doesn't have to tell the partner that they have an implant. So it's important to realize that this will vary according to the way the procedure is performed. We like to perform the implant through a tiny scrotal incision, and we like to conceal the incision, conceal the tubing that connects the pump to the reservoir, conceal the tubing that connects the pump to the cylinders, and have the patient look as natural as possible. In that way, the device is neither felt nor seen during sexual activity. We have many patients that are married over 15 years, and when their implants fail, they come back and the first question they ask me is, what should I tell my wife? And we have many single patients that don't tell their partner. In that way, it doesn't interfere with the person's confidence, and you can remain private if you want, and after you gain a certain degree of intimacy, then the person may or may not divulge that they have a penile implant. As far as I'm concerned, it doesn't really matter. What you want to have is you want to have reliability, you want to have fun during sexual activity, you want to be attentive to your partner and not worry about whether or not you're going to lose an erection. And that's what's great about a penile implant, is to have reliable, predictable erections over and over again, which allows a person to pay attention to the partner and enjoy natural lovemaking that is spontaneous. The implant is made with a soft plastic-like substance. The Coloplast implant is made with a substance called Bioflex, a substance that is also used for breast implants. The AMS, Boston Scientific implant, is made with a silicone elastomer. The Bioflex is extremely strong and durable. The pump and reservoir also extremely durable, and I've rarely seen any failures. These devices can last up to 15-20 years. Eventually, all penile implants that are inflatable will eventually fail. When they fail, they're easily replaced. The inflatable penile prosthesis is filled with injectable saline. This is the same fluid that one receives in a hospital when receiving antibiotics intravenously. It is extremely safe. It is physiological. It is filled with a physiological solution because we know that eventually the implant will fail and the liquid will then come out of the device. it will then be reabsorbed by the body and eliminated by the kidneys. So it's very, very, very safe. There are several approaches to inserting a penile implant into the body. One can make an incision above the penis, which is called infrapubic, or an incision below the penis in the scrotal area. In the scrotal area, there are two types of incisions. One is transverse, which is horizontal, and the other one, which is vertical. I prefer the vertical midline incision because it is the best approach for the patient. It is best for the patient because it conceals the scar. Also, it allows the surgeon to conceal the tubing and to operate on the part of the penis that is below the body plane. In this fashion, no scar tissue is observed or felt above the penis. One can begin inflating and deflating the device as early as 3 days after the procedure. You want to think of a penile implant like an orthopedic procedure. The body is not going to wait 3 to 4 weeks to start making scar tissue. And one doesn't want scar tissue to form over deflated cylinders. So it's important to be able to inflate and deflate the device early on in order to prevent trapping of deflated cylinders in the penis and foreshortening the penis. Once this occurs, it is almost impossible to regain the original length of the penis. Now you may wonder, why shouldn't we keep the penile implants always inflated? Well, if the implant is inflated, then the reservoir is deflated, scar tissue will form around the deflated reservoir, and the patient will not be able to lose the erection later on when it heals. So it's important to inflate, deflate early on, and we do that by minimizing the dissection, minimizing bleeding, which allows the patient to feel the deflation valve. One should not start inflating before being able to be 100% sure that you can deflate the device. Patients are able to use the implant as soon as they feel comfortable and there is no pain. We like the incision to be fully healed, which usually takes around 3 weeks before patients are able to make love. Patients sometimes need to wait a little bit longer. Patients with diabetes tend to have more inflammation and more pain post-operatively and may need to wait anywhere from 4 to 6 weeks before they can comfortably inflate and deflate their devices. On average, patients are able to start sexual activity as early as 3 to 4 weeks after the procedure. I should take this opportunity to mention that there is no limitation to any type of sexual activity. So there's no limitation with oral sex, anal sex, any type of sexual activity. A patient who has an implant is basically normal. Patient has orgasm, ejaculation. We have many patients who will have a second orgasm the same evening because they maintain their erection even after orgasm. Another advantage of a penile implant. A penile implant can fail as early as 3 to 4 years after it's inserted and can last as long as 20, 22 years are the patients, some of my patients with the longest functioning penile implant. What usually fails in the penile implant is the tubing that connects the cylinders to the pump or the tubing that connects the reservoir to the pump. The tubing fails because it's the way it's placed in the patient sometimes, if there are kinks, if the tubing rubs against each other, or if the patient inflates the pump in a way that the tubing is bent with each compression of the pump. In general, however, the average lifespan of a penile implant is around 8 to 12 years. The majority of a patient will get 10, 12 years out of a penile implant. Now, of course, these devices are continuously being improved, and we anticipate that an implant that is placed into a patient today will last anywhere from 12 to 15 years. Patients are extremely satisfied of the outcome of a penile implant. That is what is the most rewarding part of my profession, my job, is to see patients so happy. I'm extremely lucky that I have very generous patients that give me gifts and nice notes. I love to keep track of my patients. I love to get follow-up from patients either through a text or an email, and patients are so satisfied. Now, of course, what are some of the key components of a satisfied patient? Well, we want to make sure we preserve the size of the penis. We want to make sure that we preserve sensitivity. We want to make sure that the patient is able to inflate and deflate the pump easily without having to struggle. So the pump has to be positioned in a strategic location in the scrotum. We want the pump to be accessible, yet we want it concealed. All that depends on surgeon's experience, of course. There are other factors that prevent infection. Most of them involve the technique, minimizing the incision, minimizing the surgical time, and also minimizing bleeding. Blood that stays in the scrotal sac in a type of a fluid collection is a wonderful milieu for bacteria to grow. That is like an incubator in a microbiology lab at a 37 degrees centigrade body temperature. So you want to make sure that there is no bleeding, being meticulous, minimizing dissection. All that are ways of preventing an infection. Now, why is that important? Because if an infection occurs, there is no antibiotic that is going to cure that. You have to remove the implant. An infection usually manifests itself by the third or fourth week after an implant is placed. In the beginning, there's not enough time for bacteria to grow and accumulate. Now, how does a patient know that they have an infection? Well, lack of progress is the first sign of an infection. The patient is now 10 days after the implant and there is still the same amount of discomfort and pain. And then what happens, you have accumulation of fluid around the pump. Since the scrotal pump is the lowest part of the implant in the human body, it acts as a bellwether for the entire implant. And if an infection is present at the level of the cylinders, fluid will accumulate around the pump. So a patient will say, well, you know, Dr. Eid, I used to be able to feel the deflation valve. I'm now 3 weeks after the surgery and I lost the feeling of the valve. I can't feel it anymore. I have fluid around the pump. If your pump starts to attach to the skin, if there is redness around the scrotum over the pump. After a while, a patient will develop an elevated white count and then fever. So fever is one of the last sign or symptom of an infection. And that's important for patients to know because sometimes there are patients that I examine and I feel that they have an infection, yet they don't have any fever or pain, and they will not want to be reoperated again, and they think that they're doing well. Now, why is it important to remove an implant that's infected? Because the longer the infected implant stays in the patient, the more it damages the flesh of the penis. And once the implant is removed, the penis retracts and scars down and is permanently foreshortened. In addition, it becomes very difficult to put another implant in a patient that has a scarred penis. The implant will never be as good as the initial implant. The penis will never be as big. Other complications include oversizing, undersizing, poor location of the scrotal pump in the scrotum, inadequate location of the reservoir. All those are technical issues which can be minimized by being more experienced technically. The big one is infection. And I believe that having developed the no-touch technique, we have had a major breakthrough in preventing infection. Now, of the 24 patients that developed infections in 2006 in my practice, we've been able to find components that are the same. Those patients had very difficult dilations. It was very difficult to make a space in the shaft of the penis to put the implant. These patients had either scar tissue from previous implants or they had scar tissue from their underlying pathology. By having a difficult penis to dilate, that extends the surgical time. After we prep the skin, bacteria just doesn't sit there and wait until the surgery is finished to start multiplying. Bacteria multiply every 20 minutes, so we have a brief window, a brief opportunity to put in the implant. The quicker it is put in, the less likely the implant is to be contaminated. In addition, we want to make sure that every part of the procedure is only done once. In other words, when we put the right cylinder, we don't want to have to manipulate the device. So some of these patients that became infected had excessive manipulation of the device where the implant did not fit, and therefore the implant was introduced, removed, introduced, removed, reinflated, deflated, removed. So in my practice, if I'm struggling to put in a penile implant and after 2 or 3 attempts, I no longer use the same device. I take a fresh device and find that that can prevent infection. So those are some of the issues. Another issue that we find is patients who bleed, who are on blood thinners. Those patients develop a hematoma, a fluid, a collection of blood in the scrotum, and then the hematoma will then eventually drain through the incision. And once that occurs, then it's a two-way street. Bacteria gets in from the skin and contaminates the hematoma, and the implant needs to come out. So any patient that has this situation, we need to be aggressive and go back in right away and drain the fluid collection in order to prevent infection. So extensive surgical time, extensive manipulation of the device, difficult implants, bleeding are the reasons why patients become infected. So when you take a step back and look at it, what you can see is that it's either a technical mistake or a technical error, which happens. All doctors are human, including myself, or an error of judgment that can cause an infection. In the old days, we used to think that patients got infected because they had diabetes or because they used their implant too soon. All that are excuses which have nothing to do with the fact that they get an infection. It also leaves the doctor powerless in developing a technique to prevent infection.